This episode of Ask the Doctors is being brought to you by Wayne County Government. This public service announcement is a joint effort between Beyond the Church Walls Outreach Ministries and WCTV.
Hi, I'm Patty Brown, a retiree of Alcoa here in Richmond, Indiana. I'm willing to take the shot.
I'm Patty Lamson.
I'm Howard Lamson, and we represent Amigos, the Richmond Latino Center.
I'm willing to take the shot.
I'm willing to take the shot.
I'm Dr. Bhandari, physician at Reed Health. I'm willing to take the shot.
I am willing to roll up my sleeves and take the shot. Are you willing to take the shot?
We are willing to take the shot.
Good afternoon and welcome to another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. If you have a question for the doctors, get it in early. They pile up fast. You can do that on our Facebook page. Also, if you're more of a Twitter person, you can send one to @WCTV Info. We'll be getting to as many of those as we can as we try to provide you with some information during this next hour. We have a special guest in the studio this week. We'll turn, if you don't mind, Doctor, we'll turn to our special guest sitting in for Dr. David Jetmore, Christine Stinson, Executive Director, Wayne County Health Department. Thanks for being here.
I appreciate being on here anytime.
Always good to have you in. And here for week 46 in a row, or whatever that record is, Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health. Thank you for the time.
Glad to do it. Glad we've got Christine today. You know, Christine's a great example of the people who work a little bit behind the scenes. Christine gets the opportunity to be on TV and do some things publicly, but you know, she's got more than 1 foot kind of behind the scenes, making things happen, and I've got a whole team of people behind me doing the same thing. So I appreciate the kudos and the credits, but that really goes to the people working behind the scenes to make it all happen.
Same here. I get to sit in this chair and kind of be the face, but the work for this from our side is being done by others. So yes, we appreciate our teams a great deal. Have you hit the 1 year mark actually being here? I know it's pretty close.
I have been here over a year.
Okay.
I am a true veteran.
Not much more than that, though.
Yeah, February 4th.
Okay, I was going to say, I knew it was...
Yeah. February 4th, and we hadn't even been talking about COVID.
It's been a long year for you.
It's been a very long year.
Well, besides COVID, you've done so many things with the health department. I mean, I don't even think I can list them all, but here, just some of the things I know. You've moved offices, you've you started doing testing in the Elder Beerman space. You're using that for other services as well.
Yeah.
You've
expanded the building that you're in.
Yeah, expanded your building. You've implemented new programs. You've got your mobile unit that I think we're going to hear a little bit more about. And you've done a ton in the year that you've been here.
It has been a very, very busy year, and Dr. Jetmore is truly a great health officer. He is very supportive, very knowledgeable, but more importantly, we have a wonderful board. And I'm not sure that people in the community understand, and why would you? You know, how a health department all across the state are all made up of this is, you know, you have your health department, but then you have a board of just average everyday individuals within your community that sit on here and give advice and counsel to the health department. And that's a wonderful thing. They're not paid to do this. It's a small stipend, that they get to attend meetings and stuff like that. But it's 7 individuals who have given their time and expertise. We have superintendents of schools, doctors, several pharmacists, people that sit on that board. And I think Wayne County's health board is a very well-rounded and educated. My goodness, they individually all research and try to stay up to date on this ever-changing virus and have from the get-go. So I appreciate how Wayne County has responded in unity, and I think that's why Wayne County has done fairly well through this. When we look at, we never went red in the county metrics. And if you look at the community in its entirety, from our healthcare systems to our health department to our executive branches, the councils and the commissioners, the mayor, we're all always speaking one voice. And it was a team effort in all of this.
Okay. Before we find out a little bit more about the pretty shiny bus she has, give us an idea of what's been going on this week. I know as we were wrapping up last week, there was a concern, and still is, nationwide, about the amount of vaccine that is available. What's going on with that, and are things running smoothly here?
The center at our vaccine center at the Kuhlman Center is running super smoothly, and we're making minor adjustments here and there on things that we learn along the way. But gosh, it is so going so nicely, and everybody enjoys the visit there. I think that we're capable of doing probably 3 or 4 times the amount of shots there than you probably are too at your Elder Berman site. It really is just a matter of the state providing the vaccine to do that. And so the last few weeks, the vaccine supplies have been relatively limited. None of us are getting as much as we would want. And as we were going on the air, I was kind of sharing, basically this week, for the second week in a row, we've run actually kind of close. They sent not quite enough in the original shipments, and we were looking at having to reschedule some folks, but then at the last minute we were able to get emergency shipments to kind of fill the gap until the next regular shipment, and that happened this morning for us. So we are continuing on as normal as a result of that. But I think it's a matter of the state gets in a certain amount of vaccine and they allocate it all. They don't have any reserve. They had to basically take some from another center to bring to us today to fill our gap. I think going forward that's going to change. That's the kind of the signals that we're getting. The state this week is leaning into the fact that they want to lower the eligibility age to 60 if they can soon. In the conference press conference that the governor and Dr. Box and Dr. Weaver had this Wednesday, I think it was, they said soon. They didn't put any timelines on it, but but in another meeting that Dr. Weaver was at earlier in the week, she said they're hoping they can do that this coming week. But it's just a hope, and it really depends on the vaccine supplies being there as they're allocated them from the federal government. And then, of course, there's good news in the longer run that the federal government has now got lined up for 600 million plus doses that will be enough virtually to vaccinate nearly every American who chooses to be vaccinated, and hopefully by this summer. So those are all good news items. Another thing is that we have been doing monoclonal antibody infusions, which is what we would call a passive immunization strategy, and we use that in people who are recently diagnosed, have symptoms, and meet certain medical eligibility requirements. We've always thought, based on the original data that came from the 2 products that we have, Lilly's and Regeneron's, that there was a possibility that would reduce the risk for hospitalization by 70% or more. Now, what happened this week was Lilly has reformulated their product a little bit. It's actually now a combination of the original drug, bamlanivimab, and they've got another one that goes with it, so it's a double infusion. The other one's called etesevimab, and I have to still get used to saying it. It doesn't roll off the tongue quite as smoothly.
No, it doesn't.
But their data on that is much more robust. It is very clear that that strategy, when implemented early in disease in high-risk people, reduces the hospitalization and death rate 70%, which is a massive improvement for those who are highly vulnerable. We don't use as much monoclonal antibody treatments in this community as we could. We're doing around 3, 5, 6 infusions a day right now, but the numbers have come down, so there isn't as much demand. But still, I think just by looking at the data that we get on the number of cases and what their ages are in Wayne County, we could probably actually do 2 or 3 times that amount, and that would be more appropriate to the number of people who have the medical qualifications. So we need more people to take advantage of that in order to keep the hospitalization and death rate down.
What is if you don't mind me jumping in here real quick, you're saying you're not doing it as much as you could. Is it something that people have to ask for, or is it a decision that you all are making?
So when people, get diagnosed and they're having symptoms, they need to have a conversation with their doctor. Do I qualify for that? They may or may not be going to their doctor with illness symptoms. There could be people who are just, I have cold symptoms today, they're going to get tested and it's positive, so they never talk to their doctor. And particularly the 2 main things, the 2 main qualifiers are age, over age 65, and a high body mass index. The BMI number is 35 for qualifying. Now that's something that you can do calculations on. If you know your height, you know your weight, you can calculate what your BMI is, and you can go Google it, and it's easy to do. What's that?
I try not to calculate mine.
That's not something most of us want to do a lot, but if you get diagnosed with COVID-19 or test positive for it or having symptoms, we like to try to catch people within the first 3 days if possible. We can do it up to 10 days. But the evidence is even clearer that the earlier these passive immunization strategies are implemented, the better, the more effective they are. So I would say somebody who is having symptoms gets tested. If you're over 65 or you have a high BMI, then the next step is to have a conversation with the doctor, because the doctor needs to order it.
You're keeping busy, obviously. You've got a site with not only providing vaccines, you're still doing testing at your site.
We are. So a little bit of changes have happened in the testing site, where it used to be, walk in anytime, get a test. Now we ask that people schedule for that. That helps us to be able to do a better job at having enough people there and not having people just sitting there waiting. So once the vaccine became available, we saw our testing numbers just plummet, and that happened across the state, not just in Wayne County. It was almost like people were like, oh, well, good, the vaccine's here, no reason to be tested anymore. So it was a little concerning that we saw that big drop off, but we also saw that we weren't seeing our positivity rate increase. And so we do believe that, we truly are seeing a decrease in transmission in Wayne County. So trying to balance things, we have went to scheduling. Now, if someone shows up at the testing site and there's no one there, of course, we're going to go ahead and register them and get them tested. But it's always better to try to get scheduled for an appointment. But at that same site, in the Elder Behrman site, the west doors, so the doors on 6th Street, that's dedicated to the testing site. And then the doors on the south side, there by the parking lot, that's where you enter in for the vaccine. So if you have an appointment for a vaccination, park in the parking lot and come in the south doors. If you have an appointment for testing, park along 6th Street and come in the 6th Street doors.
Okay. A couple of weeks ago, we had been hearing for a while that you were going to get a new unit, that you were really excited about to be able to
Very.
take out for various things. We're obviously flu clinics and just being able to check people out in various places. It came in a couple of weeks ago. We were hoping to kind of get a peek last week, didn't do it. But this week, you're going to give us a little tour. So
Yeah.
we're going to take a couple of minutes. We're going to take a look at that. When we come back, we'll get your questions. So if you have a question for Dr. Huth, Christine Stenson, you can put it on our Facebook page or send it to Twitter at WCTV Info. Let's see what the big bus looks like.
Hi, welcome to the Wayne County Mobile Vaccination Clinic. As you can see, it's brand new. We haven't had a chance yet to get it out in the community, and we're so looking forward to doing that. Right now, our plan is to use this as a way to do community COVID vaccinations out in the outlying community. So we're thinking about where we can come to in Cambridge City, in Hagerstown and Fountain City, and then maybe some of the senior living communities, how we can come to them instead of expecting everyone just to come to us. But first, we have to get more vaccine. With only receiving 600 doses right now, we're very limited on what we can do. But that's our hopes and dreams for having this, to be able to utilize it to combat COVID-19. But when we think about the future of this mobile unit, this can be used for Wayne County for years to come. And that's what we're planning to do. So every week we will have this mobile unit out in the community somewhere. And it'll be a stationary calendar so the community can count on where they can come to utilize their services. And they don't have to come to 100 South 5th Street. For example, we'll think about Wednesdays being the day that we are taking our health fair on the road. And so every Wednesday we'll be somewhere. On the first Wednesday of each month, maybe we'll be in Cambridge City. The second Wednesday, maybe we'll be Hagerstown. We don't have the calendar set, but once we do, everyone will know. And all of our services will be offered. So you'll come to the mobile unit, you'll be able to get childhood immunizations, you'll be able to get adult immunizations. Anything that we offer now, any testing or treatment that we offer now, you'll be able to get that same service in this mobile unit out in your community.
Gosh, Christine, that looks really nice. And now, tell us about that unit. Where did it come from? Is that something designed specifically for medical use, or did you have it modified, or how did that happen?
This company, I think it's Teshco. They have a whole line of these medical clinics, or mobile clinics that you can order. Work with Ken Palst of the Wayne County Commissioners, and he kind of took the lead on that. He actually is the one that helped do the logo and get the wrap on that, which I just think it's just absolutely beautiful. I'm so proud of it. It's something that was purchased out of the COVID CARES Act money, and I think it was a good use of that money. You know, sometimes you hear about things that are purchased out of CARES Act money, and you're like, how did that figure in? But this is something that directly will be able to be used to combat COVID, where we can, as soon as we get enough vaccine, get it out on the road, get it to those outlying areas. And but then it's something that will be able to be used for years and years to come for the betterment of the community. I think that the more that we can take our services out in the community, especially for Wayne County. Wayne County is kind of a unique county in the fact that its county seat is not in the center of the county. It's very east. And so someone that lives in Cambridge City may have to drive 35 to 40 minutes to get to Richmond, where, you know, when we come to Cambridge City or Hagerstown or Fountain City, people will be able to count on that they don't have to make that whole journey in. And I think about a kid that's at Cambridge City, you know, in one of the schools over there in Cambridge City. If they need their childhood immunizations, the parent has to take them out of school, come all the way to Richmond, get the vaccine, then travel all the way back. This will be a very quick way that parents will, you know, a child will be limited on how much they have to be out of school just to get a vaccination.
That's one of the things I was going to ask. What specifically outside of COVID-19 vaccines, when that's over, when that's done, when we're back to whatever normal is going to look like, what other types of services do you envision being able to provide out of this unit?
Really anything that's in our clinical services, so childhood immunizations, we'll have a calendar and people will say, I want to schedule an appointment for the Cambridge City Clinic, and we'll go in. They'll be scheduled in the Cambridge City Clinic. For childhood immunization, any of our testing and treatments that we do, anything that our nursing services do, they'll be able to do
Out of that unit.
out of that unit.
Wow.
So it's going to be exciting, and I can't wait. Right now, I've got so many things planned for COVID that we could do with this, but I'm missing a very key component of that, and that's the vaccine. So, and people may wonder, well, why you get vaccine, why can't you do this? Because that vaccine, I get 600 doses a week, and that is scheduled. Every dose that I get has an appointment linked to it. So I couldn't just take 50 of those doses and go to Cambridge City to a senior living community and vaccinate the people there, because then I would be taking away from someone that has an appointment there. So we've asked the state, we've told them our plans, they've heard us, and they think it's a good plan. Mm-hmm. But like Dr. Huth said, the state in and of itself is limited on how many doses that they're getting. And as soon as we get more allocated to us, we'll be able to do some of these services and be able to do homebound people. There's a lot of different things that we're wanting to get done. It just is a matter of getting those doses.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We're taking your questions on the Whitewater Community Television Facebook page, as well as on our Twitter site at WCTV Info. Our guest this week, Christine Stinson, Executive Director of the Wayne County Health Department, and Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health. Let's ask the doctors. Let's ask some questions. What do we have? Do you have a time frame when the vaccine will be available for age 50 plus? We're trying to drop that number quickly.
Yeah. Well, I think that the state is not giving, us any hints or winks or nods of that, but we can kind of extrapolate out on how things have went. We've spent a couple of weeks doing 70 and older. It looks like we're going to do 2, maybe 3 weeks in 65 and older. Each age group that we open up is a bigger chunk of population that we're doing. Mm-hmm. And so this next age group, 60 and older, is bigger than that, 65 and older. So I imagine we'll probably spend a couple of weeks doing the 60 and older, which is going to be the next group. I'm with Dr. Huth. I think it'll probably be next week that they open that. Up to the 60 and older, and we'll spend a couple of weeks on that, which will probably take us into early March. And then I think they're going to do the next chunk at 65 and older.
55? Or
55 and older, thank you. 55 and older, and then the next group, I believe, is going to be 50 and older and people with, there's 6 comorbidities that they're looking at to open that up. But I would think that that's going to be, and it's a guess, into March. If I was going to guess, it would be that, but could be sooner, and it could be later, depending on manufacturing and how much we're getting that out. The game changer in all of this is going to be Johnson & Johnson. I think when you see Johnson & Johnson get that emergency use authorization, I think that you'll see things start to move quicker through the categories.
You're surprised there wasn't as much talk about Johnson & Johnson and moving them along in the process this week? It was a couple of weeks ago that I think they first did ask for that. The process, I was surprised. I was expecting I would hear a little bit more in the news this week. Didn't seem to be a lot of talk.
They don't seem to be in a hurry, do they?
No.
The FDA's series of meetings on it happen on the 26th, I think, so it's 2 more weeks.
Wow.
I'm not sure why they're not moving faster. Maybe there was a little bit more emphasis on getting, the Pfizer vaccine out there, and so it was acted on a little bit quicker. That didn't even happen as quickly as we'd hoped and thought it would. Mm-hmm. If I think back to that time, it probably took a week longer than we thought it really was necessary to do. But so The thing about the Johnson & Johnson is, and the reason it's a game changer is because it'll be one shot. Now the thing is it doesn't have, the one shot probably does not result in as highly effective immunization or immunogenesis in people as with the other vaccines. But I actually think that if it were at a two-shot formulation, it would be. In fact, they are doing studies to look at, are 2 shots of the Johnson & Johnson vaccine better than one shot alone. So comparing its stated efficacy of in this 70 to 85% range, comparing that to 95% for Pfizer and Moderna, that's a little bit of an apples and oranges comparison, because if we looked at one dose of Pfizer and Moderna, it probably would be something like what Moderna's or what Johnson & Johnson's one dose is.
But you still see a reduction in hospitalizations and death with the Johnson & Johnson. And I think that what you'll see are recommendations on who gets Moderna and Pfizer, and then who gets Johnson & Johnson. And I talked about this with my staff. When I look at my children, I have 2 children, and my daughter, very healthy, no comorbidities at all. She would be absolutely fine to take the Johnson & Johnson, and I think it would be a very good use of the Johnson & Johnson. My son, on the other hand, I've shared this with you, has a kidney disorder and has a compromised immune system for that. He would be more of a candidate that I would think would be more comfortable that we should give them the Moderna or the Pfizer vaccine. So I think that there's really good uses for both, and we can tailor down, who we give Johnson & Johnson to and who we give the Pfizer or Moderna to, and still be able to vaccinate more and more people, and it be appropriate to give younger, healthier people Johnson & Johnson, and the older and people with the comorbidities, the Pfizer and the Moderna.
Yeah, and that's, absolutely agree with all of that. I won't be surprised if eventually it gets, maybe we should use certain products with certain subgroups. The Johnson & Johnson vaccine actually works a little differently. It's not an mRNA vaccine quite like the Pfizer and Moderna's are, so it's a different technology. Still a newer technology. It's actually a genetically modified common cold virus that is modified to carry the gene for one of the proteins on the spike complex of the virus. So it's intended to kind of do the same thing. It causes the target cells to express that protein on the cell surface and therefore generate the immunity. But it uses what's called a recombinant adenovirus, which means genetically modified cold virus, common cold virus. The other way it's genetically modified is that it cannot replicate, so it can get into this, what's given can get into target cells, but it can't replicate itself and cause a cold. So, that's also a relatively new technology applied to immunizations. So it works a little differently, and I think for that reason, we could decide that it has maybe a slightly different application than the other vaccines are.
And a 70-75% effective rate is a very good effective rate for a vaccine. That's nothing to sneeze at.
And being able to do one shot means you can just get to so many more people so much faster.
Yeah.
You mentioned, Christine, that the conversation at this moment is going in about 5-year increments, getting to about 50, maybe, and then maybe adding those comorbidities. Every state is doing this differently, from stand in line and, we'll get to you when we get to you, to the state of Indiana trying to do this by age. There's always that question of the folks that are out there working and still kind of pushing things, teachers, things of that nature. Has there been any discussion that you all have heard within this state of kind of at some point getting to an age range, maybe it's 50 or whatever, and then saying, okay, there's certain groups of people that maybe we need to move to beyond just the 6 comorbidities? Have you heard anything beyond that?
I have not in any of the ones that the webinars, and we have at least 3 webinars a week where the state, talks to us, and they're standing behind the rationale that they're doing it is to reduce hospitalizations and death with this, and they're saying age and these comorbidities are the things that are the biggest factor in hospitalization and death, and age being the biggest one. And once we get down to age 50, then the comorbidities are kind of equal in that as far as death and hospitalization. So when a teacher is in one of the groups, of course they can come in and get those. And it was very publicized that we had a standby list that included teachers. But maybe what wasn't clear is that we rank the teachers then by those same categories of, so the standby list started at age 70 is when we started that standby list. So when we were doing 65 and younger, if we couldn't find anyone in that, we went down to 60. But we tried to find teachers that had a comorbidity in that. So we still have a standby list, and anyone that wants to be on that standby list can call the health department. But we will still rank that same way. We're working, anyone that's 65 and older can get an appointment. So we're looking at people that are 60 and older that have a comorbidity, and then we continue to rank 55 and then 50.
Okay. Next question. What would happen if you get vaccinated while being asymptomatic with COVID?
Well, I mean, we're probably actually doing that, because we don't test people prior to vaccinating them. That's not recommended to do, and it would be impractical in any case. There is no reason to believe that there's any problem engendered thereby. In fact, that probably happened in the clinical trials. They weren't testing everybody before they were getting vaccinated. So we don't worry about that, if somebody happens to be COVID-19 positive. If you go out to your center, Christine, or you come out to Kuhlman Center, you will be asked to take the same precautions that everybody does. Yep. Because we don't know for sure. Are you carrying the virus? Are one of us carrying the virus? Who knows? We've all been vaccinated, but we hope that means we're safe. But there's a lot that we need to learn about what immunity really means exactly after you've been vaccinated. So it's not an issue being vaccinated if you happen to be accidentally carrying the virus asymptomatically. And I would point out that the CDC and the FDA don't have a problem with vaccinating someone who has just had COVID-19 or who's recovering from COVID-19. The only thing they ask is that you not try to get vaccinated while you're in that first 10-day phase or so, 10 days, maybe 14 days, depending on how sick you are. But in that very first period where you're still actively kind of in the active phase of COVID-19 infection. And that's not because there's a problem with getting vaccinated then, theoretically. It's because we don't want people who are actively sick with COVID-19 coming into our vaccination centers knowingly. So there really is not a problem with mixing all this up as far as we know. It is still, the CDC still has a part of its guidance that if you recently recover from COVID-19, you may consider waiting to be vaccinated, not because there's any kind of a problem, but only because in the setting of limited vaccine supply, maybe you should consider let somebody else go first, because we think that you're probably have a certain degree of resistance to the disease for a period of time, at least 90 days afterwards. So bottom line is there's not a problem with having the COVID-19 virus and getting vaccinated.
Okay. Let's keep going. Next question. Is there a reason why there is no longer
Walk-ins.
There will no longer be walk-ins taken for testing?
Yeah. We talked about that. It's just a matter of staffing and being able to predict and project, where I need my staff, whether it's at the testing site or the vaccination center.
And you had some National Guard here, but they're no longer here. Is that correct?
They were extended through the end of March, so yeah,
okay.
I have them another month, but that may change. That's always ever changing. I try not to count on always having them because there's been a new initiative put in with the state where schools are given now Binex Now cards where schools can do the rapid testing of students. Wayne County schools are not going to accept the rapid test, but a lot of other schools are going to be doing that. So the National Guard is going to go in and train kind of the school staffs how to protect themselves when they're doing the testing, how to do the testing, how to do the reporting and all of that. In Wayne County, we met with the schools, and the schools don't want to get into testing. There's a lot of work that is with that, and they feel like there's a lot of places that they can get the testing now. All of those tests will come to the health department, and the student, if they need tested, are told they can walk in. We'll not turn any student away that needs that Binex Now card. So, and we can talk about what's appropriate with that Binex Now as far as students and staff go. That is to test them that they can come back early from a quarantine. So if a student has been on that quarantine and they want to return under the testing guidelines, on day 8, they can have a rapid test done and return to school if that Binex Now rapid test is negative. So we are working to try to get those Binex Now cards allowed to be done at the Cambridge City OptumServe site. Right now I don't have, haven't gotten that permission from the state to allow that to be done, but we're still working to be able to have those rapid tests there at Cambridge City also.
You've kept in close contact with the schools during this.
Yeah, they've been really a great corporation to work with, and that's all of the schools. Like I said, Wayne County has been wonderful, and it had a unified response, and that's from the commissioners, the councils, but even the school systems. You know, all of the superintendents come together, and they want to have a unified approach to everything. So it's not seen that, well, Hagerstown's doing this and Richmond's doing this. It's really a Wayne County response.
Okay. I think we have almost a follow-up to what I just kind of followed up on that, so we'll go to the next question real quickly. How much communication has there been between the local schools in reporting COVID-19 cases and minimizing spreads? Have there been any cases with children testing positive?
Well, yes. Yes, there have been school-aged students test positive. There has been not a large number, and some school districts have seen no numbers that we've been able to trace back into the classroom. The ones that we can't rule out is more of that, and that's been very limited. That there's been any cases of the classroom transmission of COVID. And so that's why there have been some new guidelines that came out where students, if in the classroom, masks were worn at all times and the desks were at least 3 feet apart, then they don't have to contact trace the students in those classrooms. And those students don't have to go into quarantine after an exposure of a student in the classroom. Now, if that same student was in on a bus, there's still contact tracing done there, and the quarantine. If the student was an athlete and there was sports going on, there's still contact tracing in that respect, and in the lunchroom because you can't wear a mask when you eat. So, but all of these things are in response to, we haven't seen a lot of spread in the classrooms, and so. If you're not seeing it, you know, let's lessen some of these restrictions to keep kids in the classroom.
Okay. Let's keep going. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We're speaking with Christine Stinson, Dr. Thomas Huth. We're taking your questions on our Facebook page as well as on Twitter at WCTV Info. Next question up. If grandparents have had both shots, would it be safe for teenage grandsons to come visit the end of March? You're going to start getting spring break questions here pretty soon.
No.
Either or. I'm not answering it.
I'm not answering it.
I think it's a hard thing to make a blanket comment on.
Sure.
Because it really depends on the situation and the risk from those kids and so forth. And so I think, everybody's going to have to make their own decisions on this. There are no rules or laws about it. You would think that hopefully you're protected, but we do know that it doesn't fully protect everybody. So there could still be some risk if one of those teenagers happened to be carrying the virus. So, there's a bit of, weighing your circumstances and deciding whether it's worth that risk, or maybe there are things that the kids, the family of the grandkids can do to kind of limit their own exposures, and you'd feel more comfortable around them. I don't want to tell anybody they shouldn't visit their grandkids, but it's probably too much to say that you can just totally dismiss any risk, because you probably can't do that.
The guidance is still, even when you've had the shot at this point, and I imagine it will be for months to come, you're still trying to do the social distancing, you're still wearing your mask. Mm-hmm. So those guidelines don't change whether you've had one shot, two shots.
Yeah, they don't. But there has been maybe little baby steps taken towards figuring out how to kind of reduce the precautions around being vaccinated. For instance, this week the CDC updated its guidance about quarantine. If you're fully vaccinated, then you don't have to quarantine, and I assume that means you don't have to be contact traced as well. That was something that last week we had this conversation when Dr. Jetmore was here, and we're like, well, it's still the case that you can have the situation where one person had COVID-19 infection, and for 90 days they don't have to be quarantined or contact traced, but you can be fully vaccinated and still be contact traced and quarantined. That was last week. This week it's different. CDC has changed that. I don't know if that's filtered its way down through the state processes to you all already.
Yeah, that was one of the webinars, and thanks for taking the fun. I was going to announce that.
Oh.
I want to announce good news.
Yeah. I mean, I'm telling you, after a year of really bad news, it's fun to announce good news. So that was announced today. So anyone that has been fully vaccinated, so what does that mean? That means you've taken both of the shots of a multi-dose vaccine, or the one shot of a single dose, and 2 weeks have elapsed. So you're 2 weeks past your final dose of that. If you're exposed again, you don't have to go into quarantine, and it's only for 90 days after that second shot.
Yeah, but I bring it up just because it's an example where you can kind of, if you read the tea leaves a little bit, you can kind of see that there are little baby steps being taken to kind of reduce the restrictions in a methodical way.
Well, in reality, we'll continue to find out more about the effectiveness and length of effectiveness of these vaccines as the weeks and months go on, because I assume they're still watching those people that were in the trials, trying to figure out exactly how long the immunity will actually last.
For both Moderna and Pfizer, there is a subgroup of participants who are being monitored for their antibody levels, and their continue to be monitored for whether they get COVID-19, what are their antibody levels, and so forth. And actually, some of them have been monitored for 7, 8, 9 months, and they still have good antibody levels and so forth. So I think that's good news. On the other hand, there are, I don't want to declare, I think it's too premature to declare victory over COVID-19 because, there are several wild cards in here. Like, for instance, across the country and in Indiana and here, that we could see the numbers are coming down. We'll see that additionally when we get to our graphs. But does that mean we're over it and everything's going to be fine in another few weeks? Well, the problem is that these pandemic type of viruses tend to have cycles, so is what we're doing now, what are all the factors influencing that downward trajectory?
Yeah.
And we hope that vaccination is one of those things that's making a positive impact, but it's kind of hard to make the case that enough people have been immunized for that to really be the case. But, so we could see an upswing just based on the natural variability or cycles that these waves of infection tend to go through. That's number one. Number two is these variants of concern. There are actually thousands of variants of the coronavirus already, but there are these 4 particular variants, the UK, South Africa, Brazil, and California variants that are very worrisome because they seem to affect specifically the spike protein. And the question is, could the virus essentially be learning to kind of escape some of the control mechanisms, including vaccination? That's possible, and we just don't know very much about that yet. There's some evidence that may be the case. On the other hand, there's evidence that the vaccines and the antibody strategies that we have still should be effective, but it just means it may mean there's a matter of time before a variant will escape that. So, and then, we have uptake problems in certain part of the population that really need to consider getting vaccinated. And I hate to say it, but healthcare workers are among those who really are not adopting vaccination at the rate that we really wish they would. Now at Reed, we're probably in the 60 to 70% range have at least started the vaccination process, but a lot of places are a lot lower, and it's very worrisome in long-term care facilities where nationwide and in Indiana, probably the average is around 25 to 35% of staff in long-term care facilities have gotten or intend to be vaccinated, and so that's not good. So there are a variety of things that can affect things going forward. We hope this downward trajectory continues, and I hate to be spilling, or throwing dead cats on the table in the middle of everybody's parade, but it's way too soon to declare victory.
Dead cats on a table.
Yeah.
Wow.
Between him and Dr. Jetmore, you guys come up with some really
dead cats.
We're going to do one more question, then we're going to get to your numbers. We've got about 10 minutes left to go in this week's show, so let's get one more question in. We're going to have you back. Will school-age children need to be vaccinated before herd immunity can be achieved? Is herd immunity what is needed to return to full school and classes?
It's way above my pay grade. What do you think?
That's
all I can tell you is we can't vaccinate school-age children simply because those age ranges are not in the emergency use authorizations.
Their threshold 18 and 16.
For Pfizer, it's 16, and Moderna 18.
Yeah.
Below those ages, we really shouldn't vaccinate. We're not supposed to. I know of a case where that happened accidentally, but that's a different story. But so as it stands now, it was neither of us. As it stands now, children can't be vaccinated, and I don't think they're even included in the Johnson & Johnson clinical trials. So that's way down the road.
Okay.
But to follow up on that second part of the question was, is that what we need to have schools open back up? No, I don't think so. I think that schools can open back up when we implement these good public health policies, the masking, the separation, and that kind of thing. Schools can open up safely. I think that we've showed that too by not having a lot of cases that were associated to the in-classroom. When a child was sick and we did the contact tracing, it's hard to nail it back to that one aha moment. It happened here, but we can see that it didn't happen in the classroom because we didn't have 4 and 5 other kids in that classroom, of that. So, but we did see this group of kids that played together at this birthday party. We had 2 or 3 cases in this, or we had, this sporting event. Sports and the outside life, the household contacts. It does definitely go through households. But if we can open the classrooms up safely with masking, with those 3 feet apart with the desk, frontward facing, those kind of things, I think that we can open up schools safely. And in Wayne County, most of our classrooms are open fully. I know Richmond is still on a hybrid schedule, and I think that's more of space issues where they just can't get those separations. That's why they have to do the
Enough
hybrids.
teachers, enough classroom
Right.
space.
Right.
Okay. We're going to get to your numbers. We've got about
Okay,
7
let's do
minutes
it.
left to go. So running a little bit behind where we normally are.
Okay. First page, but just super quickly, the last bar on the right, through yesterday there were 78 cases, and that should project to about 109, plus or minus 9 would be my confidence interval. That'll be about the same as last week's numbers came in, but I still think that that does not change the downward trajectory in the county. The next page is one I haven't brought in a while, but if you can kind of zoom in on the lower right, guys, in the control room, I did add some value-added arrows. As my boss, Craig Kenyon, likes to say, value-added things. I put some value-added arrows in here that to show the good news that since January 1st, the percent of new cases that are in the 70-plus age group are going down, about 8%, from 9 to 8%. For the 70 to 79 and 8 to 5%. Now, one thing I want to caution just mathematically, that's not a 1% drop and a 3% drop. That's actually a almost 40% drop and 40% drop in both cases. So the third page is the deaths, and we continue to have deaths that are less than what will be expected, 166 compared to 188 since October. And the last page are the read data that is just the last 13 weeks, shows that reads volumes are generally on the downswing, but not as steeply as what the county is seeing. And I think that probably just is a reflection that late in a pandemic like this, in a cycle of the pandemic, which are kind of left with, you're not having as many new cases, which are left with those people who are more severely affected. That can go on for quite a while.
Okay. We've got 5 minutes left. We're going to see if we can sneak in 2 questions, so that'll tell you how long your answers need to be. Let's go with the first one.
I have other good news that I wanted to share.
Then we'll do 1 question and get to your
Okay.
good news.
I think everyone will want to hear the good news.
For the Wayne County Health Department, I received a test confirmation for my COVID shot appointment, and it mentioned receiving a bill from your billing department. I thought there was no charge for it.
Yeah. I don't control the text messages that come out of ISDH, the Indiana State Department of Health, but I have had people tell me that their text message talks about a bill. There is no bill for this vaccine. What they do is if you have insurance, they're billing your insurance not for the vaccine, but for the administrative cost of giving the vaccine. And but there'll be no bill sent to an individual. Any of the billing will go to...
By law, there's no patient responsible on any of this. In other words, just
Right.
like you said, the bill
Right.
goes to the insurance company, but there's no copay or anything like that
Correct.
or
Correct.
deductibles or anything like that to the patient.
Right. So they are billing your insurance company, though, if you have insurance. And but if your insurance says, nope, we're not covering that or whatever, that doesn't then go to the patient. There will be no bills ever sent to the patient.
Okay. We're not going to get to the next question. We're going to find out some happy news.
Happy news. So the county metrics, I wanted to talk about that. Wayne County has been orange for a very, very long time. And on Wednesday, we transitioned to yellow, which is a lower level of transmission. So the orange level was for moderate to high spread. The yellow metric is just moderate spread of the virus. It doesn't mean that we, can throw our mask off and run through the streets. We still are seeing moderate transmission, but at a much lower level than we were seeing in the previous months. But there is now 2 things that you have to watch, not only the metric ranking, but then your advisory level. So you have to be in your county metric for 2 weeks before you lower your restrictions down. So we are hopeful, and I think that, Dr. Hoot's projections will project out that we will stay yellow for 2 weeks, and our restrictions will go to the yellow restriction levels next week, which will allow really just larger events to happen. Instead of at the 25%, we'll go up to 50% for events, as long as the space allows, them. Otherwise, it's just limited to 100 people if we stay yellow, which I think we will.
So the second week would kick in as of Wednesday. What's the
Yep.
As of Wednesday. So there would be an announcement then coming from you probably Thursday or late Wednesday afternoon that, oh Joy, we're going to have a party.
If we calculate those Monday, Tuesday, so I'll announce it Wednesday when the state announces it. I don't want to step on their toes, but it's announced at noon on every Wednesday. But we'll put out a press release on this and let everyone kind of know what the restrictions are. But masking is not being lifted, so you'll still continue to need to wear your mask when you're in public spaces. That includes gas stations. People have sent me photos, and we're kind of starting to see the relaxation of people wanting to wear a mask when they're in public. So those kind of restrictions, the social separations, and we still, advise to avoid, any kind of large gatherings.
Okay. Christine Stinson, Executive Director, Wayne County Health Department, thank you for that. It's going to be a little cold for people to be throwing parties outside just yet, but we keep getting there. Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health, once again, we always appreciate the time.
It's my pleasure.
We will be back next Friday afternoon at 2 p.m. for another edition of Ask the Doctors. I think Dr. Jetmore is coming off the ski slopes to be back with us next week or something.
He will be.
Okay. So we'll have Dr. Jetmore back with us once again. So we're looking for you to join us. It is supposed to be cold this weekend. So there has been a list put out by Wayne County Emergency Management of some on-call warming stations if you need that. So be aware of that. Thanks for watching Ask the Doctors on WGTV Channel 11. I wish you well. This episode of Ask the Doctors has been brought to you by Wayne County Government. This public service announcement is a joint effort between Beyond the Church Walls Outreach Ministries and WCTV.
Hi, I'm Patty Brown, a retiree of Alcoa here in Richmond, Indiana. I'm willing to take the shot.
I'm Patty Lamson.
I'm Howard Lamson, and we represent Amigos, the Richmond Latino Center.
I'm willing to take the shot.
I'm willing to take the shot.
I'm Dr. Bhandari, physician at Reed Health. I'm willing to take the shot.
I am willing to roll up my sleeves and take the shot. Are you willing to take the shot?
We are willing to take the shot.
The shot.